Thank you for coming. There have been 2 new positive cases in the Katherine cluster detected overnight. This takes the cluster to 25 confirmed cases. The new cases are a 33-year-old non-Aboriginal male and a 59-year-old Aboriginal female. The male is a health worker who initially had contact with an earlier positive case as part of his work. He had already been classified as a close contact. He is, I believe, the first health worker in the Territory to be positive for COVID-19. The man was fully vaccinated. However, he also has other existing health issues, so he has been transported to Borroloola Hospital for treatment. The woman is associated with one of the positive households, but had not previously been identified as a contact, either casual or close. She took a COVID test because she had symptoms. I don't have her vaccination status at this time. The interviewing and tracing for her has only just started, so there may be some new exposure sites later this morning. Please pay attention to the website and keep following the news. In a sec, I'll go through the contact tracing and testing numbers that have come in so far. Then I want to talk more about the situation as it stands in Katherine and the critical need for more testing and vaccinations. Before I do that, I just want to confirm that the wastewater results for all areas outside of Katherine and Howard Springs have come back negative overnight, including negative in Borroloola. This is extremely good news. However, given there is still a lot of uncertainty about this outbreak, and I'll explain that more soon, we aren't yet in a position to lift the territory-wide mask mandate early. We will get more wastewater results back later tonight, as well as more test results in Darwin from yesterday. It is scheduled to lift on Monday, but we will reassess again tomorrow, and I'm still very hopeful that we can lift this early for most regions. Now to the testing and contact tracing. There were 2,891 tests processed in the Territory in the past 24 hours, with 3 positive. The 2 new cases in this cluster, plus an international arrival at Howard Springs, which was reported last night. We expanded our testing capacity in Katherine yesterday, and 713 tests were taken in Katherine. We revised the close contacts number down to 373. 360 have now been contacted, if not by CDC, then by police. So there are just 13 left to locate. Just so everyone is aware that this is a territory-wide issue, we've identified 3 close contacts in Yuendamu and 1 close contact in Tennant Creek. All 4 are being transported to the Todd facility in Alice Springs. This is a reminder for everyone. Remoteness does not protect you. The vaccine protects you. And there are extra resources on their way to Yuendamu now to do testing and vaccinations. Of the close contacts, we have 215 negative tests returned so far. That means we have 158 results that we're still waiting on from the close contacts. So in terms of where we stand right now, we are feeling okay, but we're still not completely confident that we have this thing contained, and this is why. Late yesterday, we detected a positive wastewater sample in the Binjari Aboriginal community on the outskirts of Katherine. This community is within the Katherine lockdown area. There are about 200 residents in this community. A rapid assessment team has been deployed to Binjari this morning before the sun came up, and they are supported by the Worley Aboriginal Health Service. It's our intention to test every single person in the Binjari community today. We'll also get more people vaccinated there today. Yesterday, we solved part of this mystery when the genomic sequencing showed a link between the 2 clusters. The original source of the Katherine and Robinson River outbreak is the woman from Queensland who had been in Victoria without telling us. But in a sense, that just makes this mystery even stranger, because we still don't know how it went from that small first cluster to no cases for 9 days, and then a second cluster that came from the first. There is a very real possibility that there are people in Katherine who have COVID and either don't know it or don't want to know it. And those people have then spread it to the community. If that is what's actually happened, best case scenario, we got lucky, it hasn't spread any further than what we have caught so far. Worst case scenario, this has been silently spreading for a week and we are a day or 2 away from discovering a disaster. The only way to get to the bottom of this is by testing the hell out of the Katherine community. You're doing great, you need to keep doing great. I know the lines are long, I'm sorry about that, but there's no way around it. I need you to make the testing lines longer. Get tested. If you have been to an exposure site, get tested. If you have any of the symptoms I talked about at the start of the week, I'm going to repeat them again, even if they are mild symptoms, get tested. A fever, chills or night sweats, a cough or a sore throat, tiredness, difficulty breathing, nausea and vomiting, a headache, muscle or joint pain, a loss of smell, sense of taste changing or loss of appetite, a runny nose or a really blocked nose. If you have any of these symptoms, or if you have had any of these symptoms in the past few weeks, even if you think it's not serious, even if you think you're being ridiculous by getting tested, you are not being ridiculous. You're being awesome by getting tested and helping us finish this. In addition to this, there is another group of people in Katherine who we are asking to come forward for a test in the next few days. We know that people can test negative for Delta initially, only for it to pop up a few days later. In fact, one of the first cases in the second cluster had that happen to him. It was his second test that discovered the infection. So if you're previously a contact from an exposure site and you have been tested in the past few weeks, we are asking you to get tested again. And we're asking your household contacts to get tested too. It doesn't matter if you have any symptoms right now. If you were tested before because you were a contact, or if you live with someone who was, put your mind at ease, put our mind at ease, and get tested again. Finally, Katherine's vaccination rate is still not as high as it should be. There were only 98 new doses administered at NT Health clinics yesterday. About half of those were first doses. It just isn't good enough. It does not make public health sense to end a lockdown if we think there is still COVID in the community and the community is not adequately vaccinated. I know a lot of people are getting a test as a priority, and that's good. We need the tests. But you need to get vaccinated too, if you haven't already. It's actually way easier and takes way less time. So knock them both over. So our priorities for the rest of today are testing all of Binjari, doing more tracing work for the new cases, and getting as many tests done and as many jabs and arms in Katherine as is humanly possible. So for the people of Katherine, there is one clear message today. A COVID vaccine is your ticket to freedom. And a clear message to the Territory. A COVID vaccine is your ticket to keep your freedom. The more tests we get in, the higher the vaccination numbers we see, the greater confidence we will have over the weekend about when and how the lockdown can be lifted. We do not want it to be any longer than it has to be. I know you don't want that either. So please get tested and please get vaccinated.
Thank you, Chief Minister. Thank you again for coming. So the situation is we have 2 new cases. One of those cases we hadn't previously identified as being a close contact. And the other concerning issue is the Binjari community wastewater positive. In the first issue, please can I appeal to people, if you think you have been a contact with any known contacts, you may know people in the community that have been tested positive and had to go to CNR. Please come forward and identify yourselves. You can do that through the hotline and come forward to be tested. In relation to the Binjari wastewater positive, wastewater testing has been very important to us in these recent weeks. We do it ourselves now in the Territory, or at least we sent it to South Australia and we're going to do it soon. This wastewater positive is of concern because we've done a number of wastewater testing around Katherine. All of that came back negative. This community now has signalled a positive test. That has required us to now go into that community and do widespread testing and widespread vaccination. Please cooperate with that. If anybody has got symptoms in that community, please also identify yourselves so that we can be tested. I'll give you an update now on patients. So we have been following the health of a 65-year-old patient who's in Katherine in the Royal Down Hospital. Her condition is stable, but her condition is actually moderate to severe. It's important to understand that this is actually a serious infection and that we are treating her with all the best treatments that are available. We have also had to admit another patient into the Royal Down Hospital, which is the 33-year-old man that we notified you of. He has underlying health conditions, and again, he will be getting the best treatment that we can provide to him. I just also want to acknowledge the support that we've been having in the last few days in particular, but also over many weeks, from Aboriginal leaders and their communities, and particularly some of the art shows. There are many I could name, but I just want to name a few who are helping us. Obviously, Worley, Sunrise, Katherine West, and Danilo Dilba, the Chief Executive, Rob McPhee, wrote to me the other day, and they're offering to help us with cultural expertise. And this is very important at this time to encourage people to come forward. The other thing I wanted to say is about vaccination. The vaccination rate is in some communities still not at a level that is satisfactory from our point of view. Now, could I ask people to consider, if they're reluctant to come forward, particularly if they're in the lockdown area, they are allowed to come and get vaccinated. Please understand that you can get vaccinated. That there is no restriction on that, and I must encourage you to do that. And if for some reason you may be fearful of coming out of lockdown to get vaccinated, please come forward. It's very important. You will be protected if you come to those vaccination sites. The procedures there are very careful, and infection prevention and control is at a priority. So you have no fear about coming forward and getting vaccinated, please. Thank you.
Good morning, everyone. Binjari wastewater result overnight required an immediate mobilisation of our teams to ensure that we hit the ground running this morning. We brought in key stakeholders, including Worley. We engaged with the community. They agreed that the gate to the community should be closed. We liaised with the taxi industry to make sure that no people were being conveyed to and from that location, and we maintained our border checkpoint out the front of the turn-off there. So incredibly good compliance on the ground. We've had the testing teams going since early this morning. The mobile vaccination team is on the ground as well. A real testament to the collective efforts of everyone within that community and the oversight of the Emergency Operations Centre. We're hoping to be able to test literally the whole population, if we can, of the Binjari community today, so that we can have some very close monitoring and potentially identify who is positive in that community, and hope that that's been mitigated as quickly as possible as well. Robinson River, again, the community is going really well. We've searched some additional items into there just to make life a bit easier for people. We've also ensured that power cards are available so that all homes have connectivity and also linkages to their power through that period of time. We've sent a couple of additional police officers across from Borroloola as well, just to ensure that we're managing fatigue and providing adequate respite for our team that's been on the ground since Monday night and have just done an incredible job. So thank you to the Robinson River community, but also to the personnel who are on the ground there. They're doing an extremely great job in challenging circumstances, so my thanks to you all. Borroloola, equally, the community spirit that's been shown there, the collective planning events that have been in place, the fact that the wastewater test came back negative was a really, really positive story for us, and that's one we'll keep doing. But please make sure you keep your masks on for the time being and limit your mobility just in case. We are working tirelessly to try and ensure that we've got a real clear line of sight on how safe it is in Borroloola at the moment. And as I say, the community spirit and cooperation we've seen to date is a testament to you all, so thank you very much. In Katherine, again, more broadly, unfortunately, some of the alcohol-linked behaviour is coming a bit more prominent. The Commander of the Northern Region is engaged with the Director of Licensing this morning to start contemplating whether restrictions need to be in place. I put those who are misbehaving on notice. You may have a broader impact on the other residents of Katherine. I again urge you to curb your behaviour. Please understand that you are in a lockdown area, and our patients will start to change if you become a frequent flyer, which some are starting to certainly push those boundaries. Pleasingly, Woolworths were advised they're going to extend their hours of trade today, so I believe it'll be up to 10 p.m. tonight, so they've managed to get some staff back online, and that should help with people. Again, please limit it to only one person from the household if you're able to go and seek supplies for everybody. Again, please do go out and get the vaccination. That is a lawful reason for you to leave home. We are encouraging as many people in the Katherine region to get the vaccination. The vaccination clinic will be running. We're also surging some more mobile teams into other places, particularly in public places, but also we're going to look at seeing if we can firm up some further visits into people's residences for vaccinations to occur and potentially for testing where there might be some mobility issues. Again, please just be in contact with our call centre. If you do have any of those issues and you would prefer we come to you, please at least make that request and we'll try and facilitate that movement as well. I've got a request out with the Australian Defence Force to provide some additional resourcing, and that will be certainly welcome when we get that result, and I'm anticipating a positive outcome to support that. Again, mask mandate broadly across the territory is going pretty well. Please continue to do that. That will certainly help us with all the results we're expecting over the next 24 hours to understand how much longer that needs to be in place. But your compliance is certainly very encouraging and will potentially lead to us be able to make an earlier lift on that if the current trend continues. But we will await the further results just to be very, very sure. Obviously, having close contacts picked up in Yuendamu and Tennant Creek is something that we've got to have a level of consciousness of. There have been significant people who've moved around, and some close to 1,000 tests in Darwin yesterday gives an indication that there have been a lot of people visiting the Katherine region, and I thank them for coming forward so that we can get those tests underway, and those results are coming through thick and fast, which is also very encouraging at the moment. Thank you.
Commissioner, there's likely to be a protest tomorrow. If the mask mandate isn't rescinded by then, how tolerant will the police be of people who refuse to wear masks?
Zero tolerance.
Chief Minister, there is a man in Howard Springs today who will watch his father's funeral via Zoom. He flew to South Australia for the funeral. They shut the border, he was turned back, and have put him in Howard Springs for 3 days. He's doubly vaccinated, lives on a rural property. Why is he watching his father's funeral on Zoom today?
So he was turned around by South Australia. Sorry, he was turned around by South Australia.
South Australia shut the border, put him in quarantine for 1 night, put him on a plane. We've
Back to
locked
the
him up
territory.
for 3 nights in Howard Springs.
Yeah. So we're really clear. He was in the territory.
Yeah, but from Darwin, has not been to Katherine, has not been to
Yep.
Robinson River.
So South Australia turned him around. So he can't. So obviously that's a South Australian decision, not letting him into South Australia. Why he's in Howard Springs, I wouldn't be able to answer. That doesn't. On what the facts you've given me, I'm not sure why he's in Howard Springs.
He needs to pass a day 3 test because he's been in quarantine. He spent 1 night in a South Australian quarantine hotel.
Yeah, so that will go to the Queensland experience where we had an entire outbreak because someone spent time in a quarantine hotel. Unfortunately, we don't trust other states' quarantine facilities. There's been no COVID spread within those facilities. We don't have that in ours, but we had an entire outbreak and shutdown of a mine and a lockdown in Darwin because of 9 hours spent in a quarantine hotel in Brisbane. So we have known COVID spread in quarantine hotels down south. So unfortunately, the hotel quarantine system outside the Northern Territory is not great. We've not had that experience in the Territory, thank God, with the Howard Springs and Todd facilities have been outstanding. But unfortunately, we have experienced outbreaks and lockdowns in the Territory after people spent time in interstate hotel quarantine.
He passed a negative COVID test in South Australia.
Yeah. We don't trust hotel quarantine down south. We've had to lock down the territory. We've had to lock down parts of the Territory and had significant outbreaks because of hotel quarantine breaches down south. So that, I mean, the decision obviously rests with Dr. Payne about compassionate grounds, etc. But we've had to lock down Darwin and had a significant impact across the nation because of the quarantine breach in the Brisbane hotel.
Surely compassionate grounds could be, I guess, provided given that he lives on a rural property and could isolate and quarantine.
I'm happy. I'm also not aware of the case. These particular kinds of cases would go before the CHO. I'm talking to why our rules exist, and that's because of the breaches in domestic hotel quarantine outside the Northern Territory. But Dr. Payne may be aware of the specific case and can actually comment on why that decision was made.
The vaccine rate in... Sorry.
Oh, sorry, we'll go to Dr. Payne.
Thank you, and thank you for bringing that case to me. I wasn't aware of it. We have always, and I have in the Chief's office and Dr. Heggie have always been prepared to consider compassionate grounds, and the government has supported that. As the Chief has said, we have had to be very strict. Nevertheless, individual cases will be assessed on the basis of risk, and I'm very happy to look at that individual case.
providing more information about this health worker? Was the worker a tester or a worker within the Katherine hospital? What?
No, actually, this is a worker from Worley, so not one of the Katherine Hospital staff. He attended to one of the original cases. In fact, the original case of the 33-year-old, I think it was. So that's how he was a known contact, and we'd identified him as such, and he was therefore isolated. We don't expect there to be exposure sites associated with him, but there may well be with the second case, which is under interview at the moment.
And with the wastewater detection in that community on the outskirts of Katherine, have any positive cases that we know about now been to that area, or is this out of the blue?
No. There were 2 people that were known contacts there, so it's possible that they may have turned positive. So we're just waiting to do that individual testing, of course, but also the wider testing. But as I just repeat that the wastewater testing has been extremely important to us to flag areas of risk.
Considering that the previous wastewater testing around has been negative, this must be concerning given it's just on the outset.
Yes. Well, actually, we hadn't tested in this site before. We've expanded our testing. So what we've done, as you would have seen, we've been testing within Katherine, within those catchments, which have remained positive, as we've expected them to be. So those are expected positives. And we threw a cordon around Katherine to a number of other sites to do testing. And all of the others came back negative, but this one has come back positive.
Do you know what the vaccination rate's like in Binjari?
Yes, we're looking into that. It's very difficult to actually calculate it, but what we will know by the end of the day is the total number of vaccines that would have been delivered. That's a high priority focus for us while it's under lockdown in particular.
How concerned are you about the situation in Unvaccinated given the vaccination rates there are quite low?
Yes. So those are 2 contacts at this stage. Obviously, there is a risk there. Those people, of course, have been tracked down and they will be isolating and be on the way to the top facility, as the Chief has said. Yes, it's obviously of considerable concern that there has been travel of known contacts within the territory. That's exactly what we expected, I suppose. That's why we put in place the mask mandate, but also the testing requirement. So we've got controls there, and of course, as we have done all the way through this, we'll escalate those if necessary.
Chief, just on the linking with genomics, will there be any further penalties to the 21-year-old woman who brought it into the territory in light of her waterfall?
Oh, that'd be a question for the Commissioner and the work that the police are doing. I don't know if you want to take that yet, Commissioner.
At this point in time, that individual's obviously received the infringement notice. We would have to look at any further linkages, particularly where death may arise, as to whether her behaviour was reckless and what that might constitute from a prosecutorial point of view. So we'll leave that open for this point in time. Suffice to say that that individual's now left the territory, but we obviously have contact details, and as I say, we've just got to literally leave it open until such time as we get to the end of this current cluster.
Commissioner, how many territory businesses are being looked into by police for potential breaches of the show directions?
So following the presser yesterday, I did ask that question of our team. They've been out and about doing some audits where possible. Again, we're not getting much information that's linking clear and identifiable breaches. Where they have been coming to the fore, we've been heading out and have identified that a number of those claims have not stood up to inquiry. However, we know that there would undoubtedly be some people who are pushing the boundaries, so if you are aware, please keep feeding that into our teams, and we'll go and have a look. But at this point in time, we've not reached a level of a benchmark where we've seen an out breach that's warranted a sanction at this point in time.
There was an individual you mentioned yesterday who did fail to self-isolate when they were required to. Have you had any more instances of that?
Not overnight. We did have one individual at Robinson River that was out and about fairly late in the early hours, and we engaged with that individual, and they then ultimately returned home. But they're very well clear that any continuance of that behaviour will result in an infringement.
Is the number of unvaccinated police officers in the territory still 14? Has that changed since the mandate?
My current understanding is it still sits at 14, and again, we've commenced our relevant action as it relates to that under the Police Administration Act. Thanks, everyone.
Chief, can I just ask, Prime Minister said yesterday that he didn't support vaccination mandates and that people had had enough of governments in their lives. What's your response to those comments?
I haven't seen the Prime Minister's comments. Obviously, I can talk for the Territory, I can't talk for the nation or other jurisdictions. We have an incredibly vulnerable population. If you can look at the two main categories of vulnerability, which would be under 12, so people who literally cannot be vaccinated yet, and Aboriginal people. And the two come together in our remote communities where we literally cannot reach the Doherty modelling for what the 80% double dose rate needs to be in a remote community, which is 80% double dose for 5 and up until the vaccine is approved for 5-year-olds to 11-year-olds. So we have an incredibly vulnerable population in the Territory, and it's most evident in our remote communities. The mandate that we have protects the vulnerable, and I believe it is critical for the Territory. So without having seen what the Prime Minister said specifically, considering I have discussed this extensively in National Cabinet publicly for a long time, I believe our health-based mandate for the vaccine here, 3 very clear principles, is absolutely essential for saving lives and saving jobs in the Territory.
What is his approach, response been when you've discussed that with him at National Cabinet and otherwise?
I've never had anything but support through National Cabinet for all the measures we've taken in the Northern Territory.
Including the vaccine mandate?
Obviously, I won't discuss National Cabinet conversations, but I believe it's been very clear across the length of this pandemic that we've done whatever it takes to keep the Territory safe, and we've had an excellent relationship with the Australian Government, and the Prime Minister and the Australian Government have a number of times pointed out that we have done what has been necessary to save lives and save jobs in the Territory.
Have you had any discussions with either the Prime Minister or the Health Minister about the vaccine mandate here, and has there been any response when you've discussed that issue with them?
Well, I discuss this regularly, and I've always been supported in the approach that we've taken in the Territory. But obviously the Prime Minister can speak for himself.
Do you think the Prime Minister's comments are going to make the protests that we're seeing every Saturday worse?
I don't believe an anti-vaxxer needs any more help to be an anti-vaxxer, and they'll just be who they are.
The vaccine rate in some remote communities is still as low as 10% double dosed. Why is there such a wide disparity?
We'll have a update later today on the remote vax rates, so that comes out about once a week, or it does come out once a week, and it will come out later today. We have seen an uptick in vaccines across the Northern Territory. So day before yesterday, we had our 3rd highest day in Territory history in terms of vaccine delivery. The feedback, verbal feedback from the ARCHOs has been they've seen a similar uptick in their vaccination rates across the last week. So I think we'll see a good update in our vax rates. We saw, since we announced the measures for communities below 70% first dose, we've had 6 communities go above 70% first dose. So we have seen improvements in the vax rates. Obviously, there are still a couple of communities that worry me, but I mentioned Yuendamu in the past. Yuendamu's vax rate has actually climbed, not as fast as I would like, and we'll see today if it's gone up even further over the last week. We've obviously got 3 close contacts have been identified in Yuendamu. We're sending out some more resources to Yuendamu. That may trigger an increase in the vax rate there. The majority of our remote communities are high vax. There are a few that have been hesitant, resistant to the vaccine conversation. We've tried lots of different things in those communities, and we'll keep trying different things in those communities. And it's obviously been an experience equally shared by us and by the ARCHOs. So we have ARCHO data now publicly for above and below 70%. We've privately got their data for planning purposes. Very similar experiences in both sets of groups. So whether you're an NT-led health service or an Aboriginal-led health service, there are some communities that have been resistant or hesitant to being vaccinated or complacent. I think there's a good argument about complacency, that a feeling that remoteness does protect you, that we've got the borders up and you're a long way from an urban centre. I think we've seen this week that remoteness is not a protection. You know, you are not protected Robinson River. We've had 3 close contacts in Yuendamu. The vaccine's the best protection, not distance, not borders.
Is there anything else the government needs to be doing ahead of the wet season to try and lift those rates up?
As one of our priorities that we identified a while back, the high vax remote communities are basically all the top end communities, so we've had a very good effort through there. I think there are a couple of Archo communities in that what you would call the wet season areas that might need to get their vax rates up, but we've been very conscious of getting good vaccination rates through those top end communities. They're probably they are the highest populated communities as well. So the ones that are low vax in the centre are smaller than the ones that are high vax in the top end, but it has been a priority getting those top end communities vaccinated.
The MP's only recently been going door to door with vaccines in remote communities. Do you think that that has allowed misinformation to seep into some of them? I can't speak for every remote community. We are going door to door. I wouldn't say it's the first time. I think every community's had slightly different approaches to how they've done it. Some have done through the clinic, some did the intents, and then there's been a mixing of it all. So I think door to door has been done previously. Obviously, door to door allows for a much more personal conversation. In the past, there's been door to door conversations with a central vaccination location, and then there's obviously door to door with the vaccine with you. So there's differences in delivery. I think it's also about the variety of people who have the conversation. So what we're really trying to work on at the moment, and the Archos have done similar, is it's not me, it's not the Chief Health Officer or the Commissioner. We've obviously done that. It's not necessarily the local health worker. It's bringing someone else new into the community that might be a respected elder, or trying a variety of people having the conversation. It's where we need leadership from every element of community. You might not listen to me, you might listen to someone else, you might listen to that person over there. So it's how do you get as many different people as possible lending their voice to the conversation. So that's been an effort as well.
Thanks, everyone. Updated figures on the home quarantine scheme?
So I had this conversation yesterday with the Commissioner. I didn't have numbers, but the conversation was around how the testing logistics are going and everything like that. It's all been positive within the pilot. Obviously, in some respects, that's been a background to all of this. All my headaches are coming from not the quarantine pilot, if that makes sense. We've had no positive cases, no breaches. It's all good news there, so it hasn't had as much attention. It's had reporting in, but not attention. So I thank everyone in the pilots, I thank everyone in quarantine. You're all compliant people who are amazing. You're the ones that don't create headaches for me. So at the moment, it's all tracking well, but I don't have a number, unfortunately.
Will we still move to the traffic light system next week?
Yeah, that's what we're definitely looking at that. Obviously, still 22nd November, so there's been no advice to change that.
Thanks, everyone.